Cancer. The very word can evoke fear and uncertainty, sending chills down the spine of anyone who hears it. It casts a long, dark shadow over countless lives, affecting not just the individuals diagnosed, but also their families, friends, and communities. It's a disease that affects millions worldwide, transcending borders, cultures, and socioeconomic statuses. Cancer occurs when cells in our body grow uncontrollably, defying the normal checks and balances. These abnormal cells form a mass known as a tumor, disrupting normal function. Malignant tumors can invade nearby tissues and spread, a process known as metastasis. The impact of cancer extends beyond physical symptoms, affecting emotional well-being. Remember, you're not alone. There is a network of support to help you navigate these challenging times. Early detection is crucial in the fight against cancer. It significantly improves the prognosis for patients. When cancer is caught early, treatment is often more successful. Early-stage cancers are generally less aggressive and more responsive to treatment. Smaller tumors are easier to remove surgically, and cancer cells are more susceptible to chemotherapy and radiation therapy. Regular screenings and checkups are essential. These routine visits can help catch potential issues early. Screenings vary based on age, gender, and risk factors. Discuss your personal risk factors with your doctor. When it comes to diagnosing cancer, doctors have a range of sophisticated tools at their disposal. These tools are essential in identifying the presence of cancer early, which can significantly improve the chances of successful treatment and recovery. These tools help to confirm the presence of cancer, determine its stage and grade, and guide treatment decisions. By understanding the specific characteristics of the cancer, doctors can tailor treatment plans to each individual patient, ensuring the best possible outcomes. One common diagnostic tool is a biopsy, which involves removing a small sample of tissue from the suspicious area. This procedure is often performed using a needle, but sometimes surgery is required to obtain the sample. This sample is then examined under a microscope to check for cancer cells. Pathologists look for abnormal cell structures and patterns that indicate the presence of cancer. The results of a biopsy can provide crucial information about the type and aggressiveness of the cancer. Imaging tests, such as X-rays, CT scans, MRI scans, and PET scans, provide detailed pictures of the inside of the body, allowing doctors to see the size and location of tumors. These images can also reveal whether the cancer has spread to other parts of the body, which is vital for staging the disease and planning treatment. Blood tests can also be helpful in diagnosing certain types of cancer, as they can detect tumor markers, substances that are released into the bloodstream by cancer cells. These markers can provide early indications of cancer and help monitor the effectiveness of treatment. Additionally, blood tests can give insights into the overall health of the patient, which is important for determining the best treatment approach. Surgery is often the first line of treatment for many types of cancer. It involves removing the tumor and some surrounding tissue to ensure that all cancerous cells are eliminated. The extent of surgery will depend on the size and location of the tumor, as well as the type of cancer. In some cases, minimally invasive surgical techniques, such as laparoscopy or robotic surgery, may be used. These procedures use smaller incisions, resulting in less pain, scarring, and shorter recovery times for patients. Section 5. Chemotherapy, targeting cancer at the cellular level. Chemotherapy is a systemic treatment that uses powerful drugs to kill cancer cells throughout the body. These drugs work by interfering with the ability of cancer cells to grow and divide. Chemotherapy can be administered in different ways, including intravenously, orally, or topically. The specific chemotherapy regimen will vary depending on the type of cancer, its stage, and the patient's overall health. Section 6. Radiation therapy, using energy to combat cancer. Radiation therapy uses high-energy rays to damage and destroy cancer cells. It works by damaging the DNA of cancer cells, preventing them from growing and dividing. Radiation therapy can be delivered externally, using a machine that aims the radiation beams at the tumor, or internally, by placing radioactive material directly into or near the tumor. Like chemotherapy, the radiation dose and schedule will be tailored to the individual patient's needs. Section 7. Holistic care, nurturing the body and mind. Treating cancer is not just about targeting the physical disease, it's also about supporting the patient's emotional and mental well-being. Holistic care recognizes that cancer affects the whole person and aims to address their needs on all levels. This may include nutritional counseling to ensure that patients are getting the nutrients they need to support their bodies during treatment, as well as exercise programs to help maintain strength, energy levels, and range of motion. Section 8. The Road to Recovery. Navigating Life After Cancer. Recovering from cancer is a journey, and it's important to be patient with yourself as you heal. Follow-up care is essential to monitor for any signs of recurrence and manage any long-term side effects of treatment. Your doctor will recommend a follow-up schedule based on your individual needs. This may include regular physical exams, blood tests, and imaging scans. Section 9. A Future of Hope. Advancements in cancer treatment. The field of cancer treatment is constantly evolving, with new discoveries and advancements emerging all the time. Researchers are working tirelessly to develop more effective and targeted therapies with fewer side effects. Immunotherapy, for example, harnesses the power of the body's own immune system to fight cancer. Targeted therapies, on the other hand, are designed to attack specific molecules that are involved in cancer cell growth and survival. Clinical trials are essential for evaluating the safety and effectiveness of these new treatments.